My name is Jeff Keane. I'm a nurse in the East Campus operating room. I'm either circulating in the room, which is being the patient's advocate and getting the cases set up for the surgeons and the patients, or other days I'm scrubbed at the field where I'm handing the instruments to the doctors and assisting the team. I love my job. It's a lot of fun. I work with a great group of people and we're very supportive of each other.
Cases for the rest of the day today.
I've known Jeff in the OR now for 11 years. He's one of our star nurses. And I've watched him struggle with losing weight and weight regain over the last decade.
I've kind of had an up and down battle my whole life for probably the last almost 30 years. Tried many different diets. Very frustrating. You know you've done a lot of work and you've put a lot of time and effort into it, and then you're back to where you started, and you just kind of feel like frustrated with yourself.
If you just look at the data, it's really, really hard. Less than 5% of people are able to diet and exercise, get the weight off, and keep it off.
So I started considering surgery about 9 months ago. I had a couple other friends that have had the surgery, and I've seen the success that they've had.
Jeff's decision was due to laparoscopic sleeve gastrectomy. Today, that's the most common operation that patients are choosing. The operation itself is taking the stomach and downsizing it. So you can think of it as taking a cantaloupe and cutting it down to a banana shape.
This is a tool to help you lose weight. That's my #1 goal, and also to make it easier to play with my daughter, to be around for her later on in life, and to coach her soccer team.
The benefits of the operation is to lose weight, but it's not just to lose weight, because it's all the weight-related problems that come with weight. So what we know is as you get heavier and heavier, you get diabetes, sleep apnea, hypertension. All these diseases come with obesity. And the cool thing is, if we get the weight off, many of these problems go away, you get off the medications, and you're able to live a more active life. I
would like to lose about 100 pounds, if not a little more. My ultimate goal is to maintain that for the rest of my life and stay at that number. I feel very motivated. I'm ready for this. I'm excited for it. Nervous about surgery. It's a big decision to make, but I know that the end result is going to be a positive one for me. I have no doubt that Jeff's pumped up, ready to go, and will be successful. We know there's going to be some up and downs, there's going to be some challenges, but I think at the end of 6 months and a year and 2 years, we're going to see a new Jeff with more energy and healthier than he is today. I just think I'll have a happier attitude. I mean, I'm a pretty happy person right now, but there's times where inside, I'm not always happy with myself for the struggles that I've gone through to get to this point. But I think after the surgery, I hope to be happy with the way that I look. I'm very excited to have people encourage me along this road. I feel like the more people know about it, the more they'll be encouraging towards me to stay on track and stay on my goal.